So today we're talking AIP protocol. What does that even mean? What is an AIP protocol? It stands for Autoimmune Protocol, AIP. I did not invent this concept. I invented my version of this concept. And we're going to talk about today is what is it? Why do we have to do it? How does it help? The whole 9 yards in literally just a few minutes. Okay, so hang tight, buckle up. Um, so AIP is an autoimmune protocol. Okay, if you have Hashimoto's, there are two things that need to be done in order for you to get better and figure out what's causing the Hashimoto's and get better from it. That is, identify your root causes, which is not going to be the topic of this video today. That's a totally different animal, right? But we have to identify root causes. You've probably heard of that stuff, right? Food sensitivities, infections, hormone imbalances, genetic mutations, lots of different stuff. But the other part of the treatment protocol is an AIP protocol. It must be implemented. There is no way around it, and I'm going to make that case for you in just a few minutes right here today. So it must be done. It must be implemented. I understand it's very challenging and very confusing to many people. It's precisely why I'm doing this today. But it's a non-starter. It must be done, and it must be done correctly. And I'm going to break down for you today why, and then show you how you can learn how. Okay? Let's jump in. An AIP protocol lays the foundation. Okay? Because in order to get someone better with Hashimoto's, we have to do a bunch of different things. We have to check some big boxes right away that the AIP protocol is going to help us do. Okay? We need to repair the gut. Right? We need to fix people's gut. We need to take the stress off of the immune system. Right? We got to get the immune system to chill out. It's an autoimmune problem. We got to reduce inflammation, systemic inflammation. We have to do things like balance blood sugar, right? We have to figure out food sensitivities, things like that. Okay? There are really three things that we have to do initially with any Hashimoto's patient, which are going to be kind of pillars, right? They're going to be essential. We need to figure out things like food sensitivities. We got to replenish nutritional deficiencies. We have to remove toxicities. We have to do those things. An AIP protocol gets those happening very quickly, like within weeks to 30 days is the goal. So enter the AIP protocol, right? Let's go over real quick. What is it? How will it help? Why is it the first step towards health? So what it is a series of nutritional and dietary changes that need to be made. Two parts. There is a nutritional part, which involves a little bit of supplementation to help accomplish those goals we just talked about. Decrease inflammation, calm down the immune system, fix the gut, cellular detoxification, thyroid support. Right? So a little nutritional support that is paired with some dietary work. The first step of that is a dietary elimination. We need to eliminate foods from the diet that could be causing problems. Anything that could be causing a problem. Foods that cause leaky gut, foods that cause food sensitivities, foods that are causing inflammation, processed foods, all this kind of stuff. We need to remove it. My patients is at least 30 days. We need to remove those foods, going with a little bit of supplementation. How is it going to help? That first 30 days, my goal with patients is 50% symptom improvement. Okay, sometimes more. But how is it going to help? It's going to help everything. It's going to help decrease, it's going to help with the pain, the aches and the pains, the joint pains. It's going to ramp up the metabolism so people are going to start losing weight. It's going to fix the gut so digestion improves. It's going to help brain function, right? So brain fog, all that kind of stuff. So it is the first step towards renewed health and towards healing something with someone with Hashimoto's. Yes, we need to do the root cause investigation too, but we have to do the AIP protocol first because it lays the foundation and checks all those boxes. It's crucial, right? So, listen, I'm doing this a long time, okay? And what happens is anyone with a chronic medical condition, here we're talking about Hashimoto's obviously, any one of these things can be present. Food intolerances, food sensitivities, chronic infections, right? Parasites, fungi, you name it. Imbalances in your healthy bacteria, leaky gut, nutritional deficiencies, toxicities, inflammation, right? Most of your immune system lives in your digestive tract, right? So there's this constant battle going on inside your body, inside your gut primarily, which can cause serious health consequences, right? Weakened immune system, skin problems, sinus problems, headaches, digestive problems, brain problems, right? These all sound familiar, and they're part of what happens with Hashimoto's too, right? So there's this constant immune battle going on. And what that does, battle with the immune system, right? We have an autoimmune condition. And it releases things like cytokines. Cytokines are chemical messengers between the immune cells, and they're inflammatory, right? So they can cause all kinds of stuff throughout your body inflammatory wise, right? So joint pain, muscle pains, fatigue, you name it, right? They can also cross into the brain. So they can cause all kinds of neurological issues, brain fog, memory issues, mood disorders, anxiety, depression, right? These are all things that happen with an autoimmune condition that is Hashimoto's. So the bottom line is you can never get better. There's no magic supplement. There is no magic test. There's no magic medicine. There is no medicine. There's no medical treatment for Hashimoto's, right? That's why we're here today talking about this. Bottom line is you can never get better without fixing the foundation. We can't fix the house if the foundation underneath it is crumbling, right? We have to heal the gut. We have to de-stress the immune system, decrease inflammation, balance the blood sugar. It's that simple, and it can literally change your life. And it's all accomplished with an AIP protocol. Okay, I have a specific one I use with my patients. Okay, there's a couple of steps. Step one, we need to remove things. We need to remove foods, and we need to remove things that shouldn't be there, right? We need to remove foods that could be a problem. That's the easy part. I'll show you how to do it. And we have to remove bad guys too, right? We got to move like parasites and fungi and candida and all that kind of stuff. And then we can do those things with targeted supplements. We need to repair then. We need to remove stuff, then we got to repair. We got to repair the gut primarily. Okay, so once we've removed things, we need to go in there and repair the gut, decrease inflammation, balance blood sugar. Again, we use targeted supplements to do this. And then we need to replace, right? We need to replace healthy bacteria. We need to replace nutrients. We need to replace digestive enzymes. We need to replace foods. Eventually, we got to put foods back in, right? You're not. The point of the AIP, the elimination part of the AIP protocol, is not to keep this stuff forever. It's a stepping stone. We got to take them out so we can fix stuff, and then we can get people better again. And then lastly, we got to detox, right? We need a cellular detoxification. We need a body detoxification support. Again, we use nutrition for this. So hopefully this makes sense. That's it in a nutshell, gang. But I don't say that's it. That was a lot of stuff, right? And we can't do cool stuff like balance hormones, treat Epstein-Barr virus. Like we can't, like these other root causes that we may find, we can't do until we implement an AIP protocol and lay that foundation. So it's huge. So I've put together a course. Many of you might already know this, but I've put together a course. Literally, I charge a few bucks for it. It's pennies on the dollar. That I'll post below here. That you can all have access to. Just click on it, check it out. If it's something you want, great. If it's something you don't want, that's fine. But I put it together that helps my patients. This is what it is. It's like, this is what to eat. This is what not to eat. This is what supplements to take. This is how to do it. Here's sample meal plans. Here's how to implement it and do this, because it has to be done. It's essential. And I can't teach everyone on planet Earth that has Hashimoto's how to do it. But I can show you how to do it, and then you can do it. All right. So check below this video, and you'll find all the answers.